would like to introduce my group, which include me, AQILAH RAHIMAH binti ZAMBRI, SYAHMINA RIFQAH binti SAIPULLAH, ALYA ZAFIRA binti KHAIRUZAL, Siti AISYAH binti ABDULLAH, and lastly MASTURA binti JUSOH. Today, my group would like to present about mental health, which focus on anxiety. Okay, what is mental health? Mental health is a state of a well-being in which a person understands his or her own abilities. Both physical and mental health are the result of a complex interplay between many individual and environmental factors, including family history of illness and disease, lifestyle and health behaviors, level of personal and workplace stress, exposure to toxin, exposure to trauma, personal life circumstances and histories, access to support, and lastly, coping skills. We can see that whenever his or her exceed her own abilities, they will develop such kind of mental illness. It can be anxiety, depression, or anything. When the demand placed on someone exceed their resource and coping abilities, their mental health will be negatively affected. Like I said before, when someone exposed to situation that exceeds their mental health, it can be a result of them having a mental illness. For example, when someone get bullied, they tend to develop social anxiety in their life. Mental illness is a recognized, medically diagnosable illness that results in the significant impairment of an individual's cognitive, affective, or relational abilities.
Just when the caterpillar thought the world was ending, it turned into a butterfly. So, whenever we have a problem, it is okay to rest, but don't give up.
Everyone has anxiety from time to time, but chronic anxiety can interfere with your quality of life, while perhaps more recognized for behavior changes. Anxiety can also have a serious consequence on your physical health. Stressful life experiences may increase your risk for anxiety disorder too. Symptoms may begin immediately or years later. Having a serious medical condition or substance use disorder can also lead to an anxiety disorder. There are several types of anxiety disorder. They include first, social anxiety disorder. This disorder involves a paralyzing fear of social situation and of being judged or humiliated by others. This severe social phobia can leave one feeling ashamed and alone. About 15 million American adults live with social anxiety disorder, notes the ADEAA. The typical age at onset is around 13. More than one-third of people with social anxiety disorder wait a decade or more before pursuing help. Second is panic disorder. This causes panic attack, spontaneous feelings of anxiety, terror, or impending doom. Physical symptoms include heart palpitation, chest pain, and shortness of breath. This attack may occur at any time. You can also have another type of anxiety disorder along with panic disorder. Next, there are some of the ways that anxiety affects the body. Includes breathing and respiratory changes. During periods of anxiety, a person's breathing may become rapid and shallow, which is called hyperventilation. Hyperventilation allows the lungs to take in more oxygen and transport it around the body quickly. Extra oxygen helps the body prepare to fly or flee. Hyperventilation can make people feel like they are not getting enough oxygen and they may catch for breath. This can worsen hyperventilation and its symptoms, which include dizziness, feeling faint, tingling, weakness. The next one, anxiety can affect our body is impaired immune function. In the short term, anxiety boosts the immune system response. However, prolonged anxiety can have the opposite effect. Cortisol prevents the release of substances that cause inflammation, and it turns off aspects of the immune system that fight infections, impairing the body's natural immune response. People with chronic anxiety disorder may be more likely to get the common cold, the flu, and the other types of infection. Next, we continue with the next point.
We must have a balance. Stress can exist exist in the prison of a bite. Therefore, if you stress a lot, go take a break and eat something. This will help you a lot in releasing your stress.
Hello, my name is SYAHMINA and I will tell you about who are exposed for anxiety. I know that everyone gets anxious sometimes. But if your worries and fears are so constant that they interfere with your ability to function and relax, you may have generalized anxiety disorder, GAD. GAD is a common anxiety disorder that involves constant and chronic worry, nervousness, and tension. Women are twice as likely to be affected as men. The demand and stress of college life, workers' life may even make experiencing anxiety. Age group most likely affected by anxiety is those from 30 to 40 years of age. So, let me tell you about the high risk group. Firstly, who have panic attacks and also an affective disorder, and then who have history of depressed mood. A group of a prior anxiety disorder, and then a chronic somatic illnesses, and lastly a group of low mastery.
There is only one way to happiness, and that is to cease worrying about things which are beyond the power of our will. This phrase means that we should stop worrying about things that are out of our control. Even if we worry about this thing, nothing will change.
We move to the next slide. Next is for role and support in recovery for the anxiety. As a family members or as a friend, we must take an action in the process of recovery for the anxiety. These are what we can do to help them. First is we must learn about what is mental health and its recovery, because having a basic knowledge about mental health, it is easier for us to understand them well and also to have a better conversation between them. Second is to stay hopeful. By staying hopeful and believe in them, it gives the feeling for them that they are not alone in this journey and they have us and also the people around them. The third one is we must make connection with others. Although it is difficult for us to make connection in this current situation, but being isolated can impact negatively on them, because by having a large connection with others, it makes they think that they must be a better person for them to be included in the cycle also. For the next one is we must always ask the person about what we can do to help them. By having this type of question, it makes them realize that they are always have us anytime to share their problem and also to share their stories. With this, we can also know their current situation in time to time. Next is we must learn about advocacy. Supporting people to advocate themselves or to be open up themselves, especially to the psychiatrists or to counselors, is an important step for this recovery, because if they can be open up, it makes us easier to understand them well and also to know about their current situations and also to know what the problem they are having. For the last one is be the source of encouragement. It can be challenging sometimes for us is if we fear that the person that we care about may be vulnerable in their are current in their heart situations. This is where family support and close friends support is very important for them in order to them believe in themselves and to help the process of recovery for the anxiety. That's all. Thank you.
No need to hurry, no need to sparkle, no need to be anybody but oneself. We should understand that things take time and it's okay to wait for a while. Remember that a person with a lot of patience have the best attitude.
I am going to tell you about the treatment for anxiety. As we know, anxiety disorders are a type of mental disorder, so they need both treatment, which are medication treatment and psychotherapy treatment. For medication treatment is to reduce symptoms for anxiety. First and foremost, anti-anxiety medications such as benzodiazepines. It may help to decrease anxiety, panic, and worry. Besides, antidepressants were used to improve mood and reduce stress, and beta blockers to reduce some of the physical symptoms of anxiety disorder. It can relieve the rapid heartbeat, and shaking. For psychotherapy treatment, we have two treatments, which are CBT and exposure therapy. For CBT, known as cognitive behavioral therapy, to focus on teaching specific skills to directly manage worries to people who have anxiety disorders, and exposure therapy to focus on dealing with fears behind the anxiety disorders. In this conclusion, we got the lesson that can we take from this kind of mental health disorder is we need to aware about anxiety disorders. As a friend, we need to make sure our friends always in a good mental health condition by asking or taking care of our friends. Last but not least, parents also need to alert about emotional changes of their children. I hope all of you always aware or taking care of your mental health condition. That's it from us. Thank you.
Thank you.